Now, the UK has witnessed record case numbers. In response, the government has stepped up its vaccination campaign. Over 3,000 locations across England were turned into makeshift vaccination centres on Saturday. The World Health Organization says Omicron has already been detected in 89 countries. More and more are responding to the new threat. Dutch Prime Minister Mark Rutte on Saturday announced a lockdown that will limit gatherings over Christmas and close shops, restaurants and cultural venues. Shoppers rushed for some last-minute purchases before the measures came into effect. Lockdown or none, the WHO expects Omicron to become dominant in the countries where it has taken hold. Scientists warn the surge in cases could further burden overstretched health systems and lead to staff shortages across many sectors.
Well, for more, let's bring in the tireless health analyst, John Campbell. He joins us from Carlisle in the UK. John, it's good to see you again. So, as we've just seen, we're seeing a variety of restrictions coming back. The Netherlands going back into a lockdown, while other countries, such as Germany, opting for travel bans from high-risk countries. What's the most effective? Are travel bans merely kicking the can down the road?
Emphatically, they are just kicking the can down the road, Rebecca, because this Omicron variant is taking over Europe and indeed the world. It really, we're all going to be exposed to this in the next few weeks. Now, the travel bans can be useful in that they'll buy you a bit of time. So it's what you do with that time that's important. So governments in the UK and Germany, for example, are trying to greatly increase vaccination. But I think we also need to take a bit of time to increase and think about our personal immunity, how we're going to prepare for this. Because I'm convinced I'm going to be exposed to this virus in the next few weeks. So I'm thinking about things like nutrition, getting plenty of sleep, thinking about making sure your zinc levels are okay and your vitamin D levels are all right, and things that we know that, for example, if vitamin D is deficient, then we're more likely to get infected. So thinking about being ready for this, to use the time effectively, is the important thing.
Oh, that's some great tips, actually, and things that people can quite easily do themselves. But it certainly looks as though Omicron is more contagious. The data is coming in to sort of prove that, I believe. And thankfully, though, it looks like it's having milder symptoms. Some virologists even calling for a herd immunity approach. Could that be a way to go, do you think?
Well, it certainly could. I mean, if we look at the South Africa data, and bear in mind that Omicron's been spreading in South Africa for a month now, there's only about 8,000 people actually in hospital with Omicron in South Africa at the moment. And even not all of those are there for Omicron. Some have just been discovered incidentally when they've been admitted to hospital. And there's only about 1,200 people actually on oxygen at the moment. Now, there's a big debate whether this is the Omicron that is intrinsically less pathogenic, that it's intrinsically less virulent, or whether it's the fact that the Omicron has hit a population with a large amount of immunity, as indeed we have in South Africa, but as we also have in Europe now. But the combination of these two things, whatever the science turns out to be, so far in London, most of the clinical features of Omicron are turning out to be those of the common cold. So people are getting runny nose, sore throat, sneezing, general tiredness, headache, those sort of common features. Part of the problem at the moment is, of course, everyone has to isolate for 10 days. So as we saw in that clip, a lot of people, for example, healthcare workers, are actually having to isolate, so they're out of the workforce for 10 days. So governments might have to review this fairly soon, because this virus is now becoming endemic, really, for the next few months, really, for the foreseeable future.
Well, if that indeed is true, that Omicron isn't as dangerous, and that certainly is a positive thing, but we also know that it will more than likely or definitely mutate into another variant. And obviously I'm lucky. I've been vaccinated 3 times already, and plenty of other people in Europe, but there are many places in the world that aren't receiving that same vaccination level. What's going to happen there?
That's a remarkably good question. So if we take a lot of Africa, for example, if it turns out that Omicron is just as virulent, then a lot of people in Africa are going to be exposed to the virus who don't have much immunity. So there could be a lot of problems there in the next few months. Now, so far, it's looking like it's not going to be a massive issue. It's looking like it might be less virulent and causing less severe disease in Africa. So that is encouraging. But the good thing about this is potentially this is going to, as you say, give rise to a herd immunity, community immunity sort of situation. Because as more and more people are exposed to Omicron, every time someone's exposed, their immune system's going to react to it. That is going to increase their immunity. And don't forget, there's 4 coronaviruses that have been here all the time since people discovered viruses, and that they cause common cold type features, and we get those all the time. So we're all exposed to a coronavirus probably at least every year. It's just that it causes common cold type features, and we're hoping that this virus is heading in that direction to be endemic but less pathogenic, causing less severe illness and disease. But there are a lot of unknowns at the moment because so many people are going to be infected with this. Even if a tiny percentage becomes ill, that could be a problem because this is happening all at once. So all at once, this is going to hit you up like a freight train, basically, and people are going to get it all at the same time, which is good because it means it should be all over by about February or March in terms of Omicron. But what happens in that meantime is really still a bit of an unknown. So we still have to be cautious and to optimise our immunity as much as we can.
John, as ever, thank you very much for that. Health analyst John Campbell.
Thank you, Rebecca.
While several governments